It is good to be here, and it's good to be talking about a great event happening this Saturday, our Fall Take Back Day. We have been doing this, and all of these partners here have been seeing for over a decade the growth of this opiate epidemic in Wisconsin, and we've all recognized that this takes a collaborative effort. If we're going to beat this, we've got to bring together parents, community advocates, law enforcement, medical professionals like pharmacists, social services, treatment providers. Everybody's got to be involved in this solution. And that's why I'm so proud of what's happening in Wisconsin, because we do get that it takes a comprehensive approach, that we are not going to arrest our way out of this epidemic. Now, that said, we are arresting a lot of people. We are arresting a lot of drug traffickers. We are arresting people that are committing violent crimes based on the drugs that they're abusing. But we're also recognizing that we have to do other things. And never before, I've been at this for almost 30 years. I know District Attorney Graveley's been at it for at least that long, right? Sure. And I think I've never seen better collaboration between local, federal, and state law enforcement. We are working hand in hand together to get this done. And we certainly are. But we also recognize that if we're going to beat this, we can't just go after the supply side. And that's forever how the criminal justice system did it. If we've got a drug epidemic, you go after the supply of the drug and you'll solve the problem. Well, it turns out that doesn't work, because if you don't address the demand, if you leave people still willing to pay money to buy drugs that they need to get through their day, someone is going to sell them the drugs. And it's like squeezing a water balloon. You solve a problem over here, you just amplified a problem over here. So we've got to work together, and we're looking at that demand side and doing things like treatment efforts, like our drug treatment courts, where in Wisconsin, 4 years ago, we had 29 counties with treatment alternative and diversion programs. We now have 51 counties and 2 tribal communities that are doing this. And those are making a difference. More than 50% of the people coming into our drug treatment courts are ending up having long-term sobriety as a result of the efforts we're putting forward. I want to tell a great story. It's a quick one, but about a month ago, I was speaking to a group of business leaders, and I'm not really sure why this woman was at that. I think it was because she was working at one of the companies that was there, but afterwards she approached me and she said, "You don't remember me, but over 6 years ago, I completed the drug treatment court in Waukesha County, and now I'm a law student." She went on to graduate college. She's now doing well in law school, and that's heartwarming, because as prosecutors and law enforcement, we rarely see the success stories. We see the ones that continue to have trouble and that we end up having to lock up over and over again. When somebody succeeds, they disappear off of our radar, and it's good every once in a while to see that the things we're doing are making a positive difference in people's lives. So it's so important that we're all working together on those kind of efforts. And then overarching all of this is prevention. We know, on law enforcement, we're working on going after the supply side. On the treatment side, we're working hard to get help to people who are struggling. And that help includes getting more people in treatment, getting into diversion programs, having Narcan available to save those who have overdosed. We're doing all those things, but it's so overwhelming if we don't address the flow in. And that's what we're doing on the prevention side too. And that's really what we're talking about today. What we're celebrating are those kind of efforts, because Wisconsin has focused in a big way on prevention. We've invested in awareness and prevention campaigns like the Dose of Reality campaign and in Drug Take Back Day. And that's why we're here talking today about the Drug Take Back Day effort, because it's making a huge difference. We know that 80% of the people who use heroin got started by becoming addicted to prescription painkillers. So if we can address the availability of prescription painkillers, we could reduce a huge part of the heroin problem. We also know that over 70% of the time when people start abusing prescription painkillers, they didn't get them from a doctor. They did not get them from a traditional drug dealer on the street. They got them from a family member or a friend. Somebody shared their medications or somebody stole someone else's medications. And that's where we have such a great solution right in front of us, because if we can get those out of our homes, we can make a huge difference. And we can interrupt that direct path between what's in our medicine cabinets and the people who are dying from overdoses and suffering from addiction in our communities. So we are working to interrupt that, and Wisconsinites have recognized the call to this challenge. They've recognized the role they can play in every household in our state. So in the last 3.5 years, Wisconsinites have turned in over 400,000 pounds of unused medications from their homes. That's 19 semi-trailers full of unused drugs. Only 2 states have ever collected more than us, California and Texas, and there's a little bit of a population difference. Per capita, we are far away, leading the nation in the work we're doing to get this done. And you know, I talk all the time in speeches about law enforcement's doing the heavy lifting. I usually mean that metaphorically. When I talk about drug take back, I mean it literally, because every collection in spring and fall now, we're bringing in over 60,000 pounds of unused medications that law enforcement's lifting onto trucks and getting safely destroyed. So there's a simple message for all Wisconsinites. If you have prescription medications in your home, use them only as they're prescribed to you. There is no sharing. Use them exactly the way your doctor expects you to. If you have them in your home and you're still using them, lock them up. Treat them the same way you would a loaded gun, because those medications are killing far more people than guns in our state. And when you're done taking them, don't waste any time. Get those out of your homes safely. You can get them to one of over 400 medication return units all over Wisconsin. You can find where your closest one is by just going to doseofrealitywi.gov, and on there, there's a place where you can enter your zip code, and it'll show you a pin map of all the medication return units close to your home. Get rid of them right away. And then, if you want to, we'd love to see you on Saturday, October 27th, to bring them out to one of the many drug take-back locations that day, and you can also find those locations on doseofrealitywi.gov. All Wisconsinites have a role to play in fighting this epidemic. And amazingly, cleaning out your medicine cabinet is not just the easiest thing you can do, it's also one of the most effective things you can do to be part of the solution. So again, this Saturday, October 27th, collect them all up. This includes even pet medications. If mom and dad have a whole bunch of medications at their home that are their seniors and they're not taking those medications, help them get those collected up. Bring them in, get rid of them, and we're going to together make Wisconsin safer and stronger. And this Saturday we'll have our partnership with Wisconsin DOJ, the Drug Enforcement Agency, and over 300 local law enforcement agencies, such as many right here in Kenosha County, that will be working to get those collected together. So I'm honored to be joined by some of our partners who are helping make these drug take-back days a big success year after year, and one of them is Sheriff Dave Beth. Sheriff?
Thank you. First of all, I'd like to thank Attorney General Schimel for leading this charge in the state of Wisconsin. And we have here in Kenosha taken back thousands of pounds of drugs in the last few years. It's amazing to me that the little boxes we have right here hold so much, and so much comes through them. I'd like to share one story of a person that was in our jail here this last week or two. It was a 39-year-old woman, and we come to find out that when she was 13 years old, she had migraines, and she was given medication, an inhalant, and at 15 years old, she was given oxycodone, and she, without knowing it at that time, became addicted. She now has a heroin issue right now, and both her and her family are fighting this problem. So this isn't something that, as the Attorney General spoke of, that as law enforcement, we can go arrest our way out of and incarcerate our way out of. We have to work together to get rid of the medication that we have sitting in our homes. Last week, I hosted 2 different meetings, and I asked all in attendance, who here has medication that are based on opioids in their house that you probably should get rid of? Over half of every single person in the 2 meetings raised their hand. This is the time, this Saturday, to make a concentrated effort to help get rid of these medications that are really hurting our entire society. And again, I want to thank the Attorney General for coming down here, Chief Miskinis, and I'd like to introduce the District Attorney, Michael Graveley. He's been pushing for, and he actually got it going about 1.5 years ago, a program that I'm sure he's going to talk about, but we just started the Narcan program in our card, and we've already got saves. And to think that 57 people in Kenosha County died in 2017, and hundreds were saved, means we have a huge issue here in Kenosha and really everywhere through the state of Wisconsin and the country. So, District Attorney Michael Graveley.
Thank you, Sheriff. What an honor to be part of this distinguished group of people who really have spent decades combating the epidemic that we now face. And I think I speak for everyone here to say that in our history of law enforcement, which goes back to the late 80s for many of us, we've never seen an epidemic of this magnitude. I've watched several drug epidemics come through Wisconsin and through the country, and I've never seen one that has had the impact of the opioid epidemic we're suffering now. Has consequences in our foster care system, is throughout our criminal justice system, and really in our public safety in every way that we think about it. So a couple things are really important to me in terms of what we're doing today. The first is we should never lose an opportunity to be sure that people in the public understand that prescription medications that are opioids and heroin are exactly the same thing in terms of their addictive properties, in terms of the impact they have on the human brain, and in terms of really ultimately the impact they have on the human body and on public safety in your community. So for those people who have thought to themselves, oh, you know, I'm concerned about someone I care about, but it's really just prescription pills, or I'm concerned about myself, but it's really just prescription pills. The public needs to understand that we're talking about the same real set of substances with the same interactions with the brain, that opioids are heroin and oxycodone, Vicodin, all of those common things. The second piece is that I've been to so many different community meetings, and I've heard people at the end of my talk about what is going on in Kenosha County ask me, well, what can I personally do? What is it that I as a private citizen can do? Because people feel hopeless about the situation when they hear the magnitude of the crisis. And really today we're talking about one of those tangible things. You can go to your own medicine cabinet and you can be part of the solution. When we talk to people who are in our drug courts for opioid dependence, when we talk to people who are in our opiate diversion program, a DA program that we've had now more than 60 people be a part of, when we interview them, they tell us that not only was a common source of their early profound addiction the raiding of medicine cabinets of their family and friends, but we also look at folks and think about home burglaries in our community and know that if you talk to persons in an honest frame of mind about home burglaries, they'll tell you that the most common targets of home burglaries are firearms, and then the very next thing is the medicine cabinet. And so again, this is a way to make your home a home that is less helpful to persons in feeding their addiction. It's a chance for you personally to have an impact in this. It's a chance to help this community be safer.
Chief, did you want to make any remarks today?
I hadn't planned on it, but
Oh,
in the company of these
twist your arm?
great people, when the Attorney General speaks, we tend to. So I say that partially in jest, but under the leadership of the Attorney General Schimel, District Attorney Graveley, Kenosha County's law enforcement management, so the sheriff, Beth and I, and Pleasant Prairie have all stepped up doing all the parts that we can do. There's a prosecution part that's taken care of. There's an education part that we're all involved in. This is a preventative part. And the saying has been out for many things, it takes a village. In this case, it truly does. Law enforcement, all those people up here can't solve the problem. We can't make a dent without the assistance. So the drug take back program, easy way, best way for the common person to help a significant goal.
Okay. Well, we'll reiterate, this is it, your opportunity to be part of the solution. Every citizen in Wisconsin, including right here in Kenosha County, you've got your chance to be part of the solution. You can go to one of these return units, like right here in the lobby of the Sheriff's Department right now, or you can go, you can show up at the drug take-back locations on Saturday, October 27th, and get all those unused medications out of your home. You can empty out a drawer and give yourself more room for things like socks, whatever else you might need room for. So with that, we're happy to take any questions. I don't see any.
I just have one question, and it stood out to me when I was researching this morning, is how Wisconsin has become such a leader in this initiative, where the volume that they take in, and I think they led in agencies involved in participating. Has Wisconsin always been the leader in this, or when did that happen, and how has that happened?
Well, really, as a nation, we didn't start waking up to this epidemic until 6 years ago. And then it was a lot of public safety and public health professionals who were talking about it, but we were kind of out in the wilderness at the time. One of the really great changes that's happened is now you'd have to be living under a pretty big rock to not know that this drug epidemic is destroying lives in Wisconsin, and that something has to be done. Not everybody's quite getting yet what their role is, but at least they know that we can't just let this keep happening. So I think in terms of, everyone got that we have to start going after the drug traffickers more effectively. We've been doing that for years. I think the place where Wisconsin's really led is the recognition that that's not the only piece of the solution. And that's where we've made a difference. And that's where you have law enforcement participating and supporting drug treatment courts, carrying Narcan, which, just 6 years ago, that wasn't they've got enough stuff on their belts, and that wasn't one of the things that they were gonna be involved in. They say that's for EMS. Well, now you see the opposite. Law enforcement saying, hey, we're oftentimes the first responder at that scene, and we don't wanna be standing there for even 2 minutes that it takes for the ambulance to get there, or for the fire department to get there. If we can do something, we wanna do it when we get there. So there's really been a sea change. There's been a kind of a breaking down of the traditional roles that this is my job, this is your job. Everyone recognizes it's all of our job to help keep that person alive another day and take advantage of that day by trying to get them the help they need.